All right, let's talk about asthma. It's a condition that affects millions of people, but there can be a lot of confusion around it. So today, we're going to break it all down, step by step. We'll look at what's really happening during an attack, all the way to how people can live full, active lives. Ready? Let's dive in. So I want to frame this whole explainer around one big central question. What is really going on inside your lungs when an asthma attack hits? It's a pretty dramatic event, so let's get to the bottom of it. Okay, so let's start with the official definition, because it gives us some huge clues. The first keyword here is chronic. That means this isn't something that just comes and goes. It's a long-term condition. And the second word is inflammatory. That's all about swelling. So right away we know we're dealing with a constant sensitivity and swelling in the airways. Now, these are the classic signs you hear about. But here's the thing, they're not the same for everybody. For one person, it might be a mild wheeze. For another, it's severe shortness of breath. And that cough, the one that seems to pop up mostly at night or super early in the morning, that's a really common telltale sign. The big takeaway here is just how personal and varied these symptoms can be. Okay, now we're getting to the heart of it. Let's answer that question we kicked things off with. We're going to do a play-by-play of exactly what's unfolding inside the lungs during an attack. The really crucial thing to get is that an attack is like a triple threat. It's not just one thing going wrong. Imagine a tube for air to pass through. First, the muscles on the outside of that tube squeeze down hard. At the exact same time, the inside lining of the tube gets all swollen and inflamed. And then, to top it all off, the body produces a ton of extra thick mucus that starts to clog everything up. All three things happening at once is what makes it so hard to breathe. So, that's the what. But what about the why? What actually kicks off this whole chain reaction? Well, it's not a simple answer. It's really a mix of what you're born with and what you're exposed to. Yeah, think of it as a two-part story. On one side, you have your genes. If asthma or allergies run in your family, you might just have airways that are naturally more sensitive. But that's only half of the equation, right? The other half is your environment, all the things around you that can act like a spark and set those symptoms off. And here are some of those common sparks we're talking about. These are the triggers, and they're everywhere. We're talking about stuff in the air like pollution and smoke. Then you have all the classic allergens, dust, mold, pet dander, pollen. But it can even be something as simple as breathing in really cold, dry air, or even just catching a cold. That's enough to trigger an attack if your airways are sensitive. And speaking of triggers, there's a pretty interesting special case here. For some people, the very act of exercising, which we all know is great for you, can actually cause their airways to narrow. This happens a lot more when the air is cold and dry, which is why you might hear about it with winter sports. Okay, I know. Hearing about all those causes and triggers can feel a little bit daunting. So let's shift gears and talk about the solution. And the magic word here is control. Because while there's no cure for asthma right now, it is absolutely 100% manageable. So what does control actually mean in practice? Well, it really boils down to three clear goals. Number one, you want to tackle that underlying inflammation we talked about. Doing that is the key to, number two, preventing asthma attacks from even starting. And the whole point of all this is goal number three, maintaining normal lung function so you can go about your life, active and without limitations. The main tools to get that control usually fall into two big categories. It's helpful to think of them as preventers and rescuers. The corticosteroids are your long-term preventers. They work behind the scenes every day to calm down that swelling. Then you have the bronchodilators. These are the fast-acting rescuers. They work by relaxing those tight muscles around the airways to open things up and give you quick relief when you need it. All right, and that brings us to the final and maybe the most important piece of this whole puzzle, your active role in managing your own health. So yeah, this whole thing is all about being proactive. Step one, you basically become a detective. You work to figure out what your personal triggers are, and then you do your best to avoid them. Step two, you work with a doctor to create a personalized action plan, so you know exactly what to do. And step three, you keep tabs on how you're doing, often with a really simple tool called a peak flow meter that just checks how well you're breathing day to day. And I really want this to be the message that sinks in, because it's so important. This isn't a diagnosis that has to hold you back. I mean, this quote says it all. With consistent care and by taking an active role, living a full, active, symptom-free life isn't just a possibility, it's what's expected for most people. So I'll just leave you with this question to chew on. Whether this is about you or someone you care about, what's just one small change you could make starting today to get a better handle on your environment and what your potential triggers might be? Just something to think about. Thanks so much for tuning in.